Welcome back to Teens, a channel dedicated to helping teenagers understand the different areas of healthcare. Today, we have with us Dr. George, one of the best dermatologists in the St. Louis area. Dr. George, thank you so much for being here with us today.
Thank you for having me on.
No problem. It's our honor. To begin, I'd like to ask, what inspired you to go into the medical field? And of all professions, why did you choose to become a dermatologist?
I wanted to go to the medical field because for me, it was a perfect combination of both science and helping human beings. I feel like one of our main roles as humans on this planet is to help other people. And being that medicine is really a vocation and a calling, it was for me a way to do that, plus blend my love of science to make that a reality. Dermatology in particular called me because find myself to be a very visual person. And what we do in dermatology is making diagnoses 95% of the time based on what things look like, of course, to your own naked eye. So certainly we have to do other procedures often to make certain that we have the correct diagnosis, but being able to see something and instantly, for the majority of cases, know what it is was very attractive to me. Plus, in dermatology, we get to treat people of all ages. So it's not just pediatrics or adult medicine, but we treat patients who are newborn babies all the way over to, I have several people that are over 100 years old, and all skin types, all skin colors. And it's fun because things look different on a different background. So someone, a rash or a spot of concern on someone who is Caucasian with white skin may look very, very different on someone with skin of color. So it's interpreting different cues and different palettes and different colors on a wide range of people and skin types. Makes it interesting.
Becoming a dermatologist is a huge accomplishment. What has been your favorite part of your journey so far as a dermatologist?
I think it's really just my favorite part is just being a physician, which to me means being able to help people through their days and through their journey of life. It's really rewarding when someone comes in very concerned about a spot they have, and oftentimes they're up and awake at night concerned that that spot might be a skin cancer. And oftentimes just, reassuring them that the spot is normal and putting their fears to rest. Even just as simple, to me, what is a simple call for me to make is a tremendous gesture in their life and their path in life to know that things are okay. So it's just really rewarding for me to be able to help people and make really impactful changes every day.
And rather than being employed by a hospital, what made you start your own practice?
There are certainly benefits to being an employed physician. There's a lot, it's a trade-off in headaches. When you work for a hospital system or in dermatology, actually, many dermatologists are employed by private equity groups, which are larger corporations that are backed by private investors. So rather than owning your own practice, you have a board of people to report to, or the corporation does. And for that, there comes the trade-off where you're giving business managers the ability to run your practice, the business side of your practice. And their sell on that is that, oh, well, then you don't have to worry about the headache of running a business, and you can just do what you love to do, which is being a physician and being a dermatologist. But along with that trade-off goes the ability to have control over your practice environment, how things are run, being able to really state your own personal vision and your mission for your practice and translate that into routine daily care. Along with the trade-off also goes there's a much greater financial reward to running your own practice and running your own business if you do it yourself than letting a hospital or a private equity company take that quote burden off of your shoulders. There's a reason why hospital systems and private equity companies want to own dermatology practices, and that's because there's a tremendous revenue to be had, and they want a part of that profit. But when you get this far in life and to be able to accomplish things like becoming a physician, matching in a dermatology residency program, doing all the things that it takes to get to this far to become a dermatologist, the majority of us are well equipped to take on the additional role and responsibility of running a practice, of running a business. It's not that hard. Certainly, it's a more work, but the reward at the end for having your own autonomy is tremendous.
And now that we know how you are where you are, I'd like to ask some general questions regarding the skin. First off, what are the most common skin conditions?
Most common ones we see are people worried about spots on their skin for a possibility of those being skin cancers, like a mole that they think is new or changing, and then worrying about that mole being a cancerous spot. The other things that we see most commonly are acne, warts, and then rashes such as eczema, atopic dermatitis, and psoriasis.
And what are the primary causes of these conditions?
As far as spots in the skin and skin cancers, which is again a large part, makes up a large part of what dermatologists do, the majority of skin cancers are caused by sun exposure. So, you know, plays a tremendous role, but also people using tanning beds has really increased the risk of skin cancer development. So, using good sun protective methods like wearing sunscreen every day, wearing big hats, trying to stay in the shade, trying to limit your sun exposure during most potent hours of sunshine between 9 a.m. and 2 p.m. or 4 p.m. is really important to minimize that risk. Other things like acne, psoriasis, eczema, far and away, those things are relatively out of our own control. So there's not much, unfortunately, as an individual can do to prevent those things from happening.
And what are the most common symptoms of skin conditions? We already touched on this a little bit, but I'll expand more on this topic.
Yeah. So again, going back to the spots that people are concerned about with, moles that could be cancerous or skin cancers developing, those things are often new spots that develop. For melanoma, which is the most worrisome form of skin cancer, we talk about the ways to educate our patients to recognize those are the A, B, C, D, E's. Of a funny looking spot. So A stands for asymmetry, a spot that's not the same on both sides. Stands for border. So if the borders are jagged, irregular, not very well defined. Stands for color. So if it has a lot of different colors in it, if it's a white and a brown and a black and maybe a red and a purple, not one uniform color throughout. D stands for diameter. So anything larger than 6 millimeters, which is a pencil eraser in size, that's a warning sign. And then E stands for evolving, anything new or different or changing. So that's the most worrisome form of skin cancer, but there are other two forms of skin cancer which are far more prevalent than melanomas are basal cell and squamous cell skin cancer. And those often start as new pink bumps or pink flat patches that can be scaly, crusty, sometimes bleed and scab and don't heal.
And for conditions such as acne and dermatitis, what are some common treatments?
Common treatments for acne, one of the mainstays of treatment is using prescription creams on the skin every night. Retin-A is one of the first that was developed for this condition, and it's still one of the most important. A lot of the molecules that have been developed since Retin-A are variants of that theme, but they turn over the skin cells faster to help unclog the pores and prevent new acne spots from developing, as well as getting rid of the ones you have. And that's the most important part of acne, getting acne better, treating acne, and keeping it from recurring. As far as eczema and psoriasis, some of the more commonly prescribed treatments are topical steroid creams and ointments, prescription ones that are applied to the skin to calm the inflammation down. And in the last 15, 20 years in dermatology, we've seen the dawn of a new era where we now have what we call biologic molecules, or very specifically targeted treatment options to essentially almost make the spots of psoriasis and eczema disappear. A lot of the treatment options we have now have cure rates close to, not cure rates, but clearance rates close to 100%, where people can live without the burden of their disease, which has really revolutionized our care.
And as of now, what is the biggest challenge facing the field of dermatology?
I think the greatest threat is perhaps twofold. One is the encroachment of hospital systems and private equity in dermatology, because when we don't have as much autonomy as physicians in determining how our patients are treated and how we want them to be treated, and a lot of that control is given over to business people. I think that our odds can be, our goals for the patient can be sometimes at odds. And then the second biggest threat is to physician reimbursement schedules. Actualized for inflation, physician reimbursement has fallen over 50, close to 70% over the last 20 years. And even just in January of 2023, the coming year, Medicare is threatening to cut physician reimbursement by 8.5%. And that's the highest cut that they've threatened in during a time where it is the highest rate of inflation since I've been in practice. So we have inflation running over 6%. Your reimbursement rates are falling by 8.5%, but the cost of running a business is climbing. Your rent increases every year. Your staff needs raises every year to keep up with the cost of living. So cutting our ability to bring in revenue is really threatening physician practices. And Medicare sets the payer rates, and then all the other commercial insurers, for the most part, follow what Medicare does. So if Medicare cuts by 8.5%, that means the large commercial insurers like Blue Cross Blue Shield, Aetna, Cigna, United Healthcare, all of those cut their payment rates as well.
And how can people help, whether that be donating to an organization or something else?
How can people help? I think just having first of all, the most important part is having an awareness. In medicine, we don't get to decide what we get paid. Like most any other specialties, attorneys get to decide how much they charge an hour. Most other specialties, most other industries have unions that are able to lobby for them to go in front of Congress and our legislatures and say, this is why we need the things we need to practice and do their job efficiently and do it well, and to attract the best and brightest minds. And physicians are not allowed to unionize. So a lot of our concerns are not being addressed. So it's a challenge because medicine is becoming just one big conglomerate, because, insurance companies are making deals with pharmaceutical companies, who are making deals with pharmacy benefit managers, much to the benefit of the bottom line of running large corporations, but much to the detriment of healthcare and our ability to provide really good quality care for our patients.
And last but not least, what advice do you have for young people that aspire to become medical professionals?
It is, first of all, the greatest job in the world, and I couldn't imagine doing anything else. Nothing, other than being a mom. I have a 13-year-old son. Nothing brings me as much joy, and it's so rewarding to be able to get up and get out of bed every day and love what I do. But at the same time, I think young people who are considering going into the practice of medicine do need to know that it's going to take them many years of postgraduate education. For example, I went directly through and didn't take any time off. And I was 30 years old by the time I was able to practice medicine. So a lot of your friends may be their earning potential is tremendous right after college, but you're still paying tuition And then even when you come out, you're still not making much money. So the trade-off is great because it's a huge sacrifice in your life during your younger years, a sacrifice financially. And if reimbursements keep declining, you have to strongly consider whether or not financially it's worth it. Because taking on the burden of a medical school debt in the face of declining payments and declining reimbursement rates that have not gone up in over 25 years and continue to go down are going to make it a tremendous challenge for people to continue on in this profession.
All right, that's it for this video. And Dr. George, thank you so much for the opportunity to interview you.
Thank you. Thank you for all the great questions.